Okay. So welcome, everyone. Thank you so much for joining us on this Sunday morning or afternoon, wherever you are located. We will be conducting a session on the ERAS application and supplemental application, which I understand has been subsumed by the ERAS application. So we'll be talking about the ERAS application and kind of answering your questions. I hope all of you had an opportunity to check out the videos that we did on both the CV and the supplemental application last year. We did receive some questions, so we'll go through those questions as well. But before we start, I want to introduce our panel today. We have Dr. Nauman Ashraf, Dr. Asif Khan, and Dr. Sadiq Naveed. And then we have a few moderators as well. So Dr. Nauman Ashraf is the chair of APNA YPC. He's the co-chair of PAPANA Education Committee, and he's the program director of General Psychiatry and Addiction Medicine Fellowship at University of Missouri. And then we have Dr. Asif Khan, who is the president-elect and chair of the Education Committee at PAPANA. He's also the director of Psychiatry Residency Training Program and director of Inpatient Adult and Geriatric Psychiatric Services. He's an assistant professor of psychiatry, and he is at CMU College of Medicine Medical Education Partners. And then for Dr. Sadiq Naveed, he is the psychiatry program director at Eastern Connecticut Health Network. And he's the associate professor of psychiatry at University of Connecticut and also at the Frank Natter School of Medicine. He's also a fellow of infant parent mental health at University of Massachusetts in Boston. And then we have, so those are our panelists. They are the people who will be answering your questions. So in short, all of them hold some leadership position within the institutes that they are at, and all of them are program directors. So you will get a program director's perspective through this session today. And then in moderators, we have Dr. Fauzia Arain, who is a psychiatry resident at Rutgers, and she also chairs the media committee. And then we have Ramesh, who is a child and adolescent psychiatry fellow at, I'm forgetting Ramesh. It's just slipping my mind where it's
Institute of Living, Hartford.
Institute of Living, yes, Institute of Living. And he is a part of our training and mentorship committee. And then I am an assistant professor of psychiatry and associate program director of Child and Adolescent Fellowship at UCLA. So you have a full panel. And before we start, I would request all of our panelists to give some opening remarks as we go into it. I see Dr. Nauman Ashraf is already unmuted, so we will start with him.
Okay, well, good morning, everyone. So yeah, let me just take a few minutes to talk about some of the pointers, and then we'll go into the Q&A after all the panelists have shared their thoughts. I think the most important advice I can give you is to be honest and to be genuine. That's going to be the main thing for the entire application process. So for CV, sometimes people think that, oh, I had a gap and I have to make it up, and then they make up some rotations or put some stuff that's not really genuine. And then when you may get an interview based on that too, but when you appear for the interview and the program directors are experienced, because they've been interviewing so many people, or if not program directors, their faculty members have been interviewing people for years, they can pick up on those things. So the unfortunate part is once they find out, then they try to get verification about it, and if there's no verification, then you can be barred for years to apply to the same process. And then I know some people, some things happened to them, and they were never able to come back to the U.S. Education system. So do not waste your all your career on that. Just be genuine, just be honest. So that's the most important advice I can give you. The other advice is if you've gone through our YouTube links that we had shared, we always talk about it. When you're writing your CV, try to use your active voice, not your passive voice. So for example, if you did an experience, so you can say that I was part of this team and where Dr. So-and-so managed the cases and I was observing with them. you can flip it and say, I actively managed case. If you managed under the supervision of Dr. XYZ, if you did externship. So talking in more like an active voice. And also if you can summarize the experience, you all know there are so many applications and we are busy, so we don't have time to go through every single application. And on an average, if you ask a lot of people, faculty members, how much time do you spend on application if you have 200 or 300 to go through? It'll be somewhere from 2 to 5 minutes. So then they won't have enough time to really read about everything. So if you can summarize, if it's a paragraph, very small, but I would prefer that if you can do in a bullet points in active voice, then we can easily glance over it and be like, okay, that's important stuff. So you can what happens is this, everyone has their own way of screening. For me, I do like a temporary one. I go through some application, if there are 200, 300, and I find out the good 40, 50, and then I go through it again with like a different lens, and then I read everything about the application. So for me, it's very important to, if there are things that you highlight and that are important, you can talk about. Your CV has to be aligned. This is, we always talk about it. It's a bottleneck right now. Too many applicants, too many positions outside. The problem is the residency training. Very few spots are there. So if you're applying, it's going to be very competitive. If your CV is not aligned for any specialty right now, it's going to be harder for you. So like if you're applying for psychiatry and you talk about your observation externship in pathology, in OBGYN, and surgery, that may not be very aligned to psychiatry. So see if your experience is that. So this is, I think it's getting to the point where we have to think about the field like in our medical school and then try to align our experiences. But even if you've graduated, see what else you can do that's aligned to the specialty, the research, volunteer experience, observership, externship, everything should be aligned towards it. If it's not aligned, and if it's like the example I gave you, then see which field would be better for you. Maybe family medicine is better if you have surgery and OBGYN experience and internal medicine rather than psychiatry, right? So thinking about it. Then the one thing that comes up a lot is, and people are doing it, should we use Chat GPT and take help from Chat GPT to find out to work on any piece of the CV, whether it's a paragraph or a personal statement or whatever. So there are softwares that can detect it. So I would say do not completely rely on that. Your idea has to be genuine. It has to be yours, and it has to be written in your own language, the way you talk, the way you think, because you can have a very nice CV done, flowery, and you can submit it. But when I'm interviewing you, it won't match. I mean, you've lost your chance, right? But if it's written just like you think and just like you speak, then you have a. Can you hear me? I got a message. Yeah. So then you have a better chance, even if your English is not like an American. We know like you did not grow up here, but it has to be your own. Yes, for typos and punctuation, you should have someone who can review it. You can use Grammarly, but it has to be your own thought process, the way you think, and that should be reflected in the CV. So for ChatGPT, yes, if you get stuck somewhere, you want to get an idea, can take some help, but has to be your genuine thought process. Do not steal. Do not just write down the, hey, write me a paragraph on observership based on this, or write me a persistent based on this, and you copy and paste the entire thing. There are software that can pick it up. So keep that in mind. The last thing that I always talk about, there are 6 core competencies we program directors train you on. Knowing about it is good, because any part of your CV, when you're working on it, see if you can reflect it. You can tell me through your CV that you have some sort of knowledge on that. See, so not medical knowledge, your exam scores will cover that. Patient care, your observership, your externship, try to explain it in a way where I know that, yes, you have worked in this specialty, you understand the specialty. And if you worked in the US, do you understand the EMR? Do you know the cultural context? So try to share stories about it so we can know that you understand the system-based practice and you worked here. Medical knowledge, as I said, will be covered. Patient care, problem-based learning and improvement. If you can talk about that you had some discussions during your rotation, your letter writer can write in the LOR. That's how it can be reflected to your professionalism. If you doing a rotation, you were there on time, you were organized. Try to share some of the stories that can talk about that. And system-based practice, we understand how things work in the US. If you're part of the discharge planning and teamwork and worked on the consultation service. That gives us an idea that you understand those competencies a little bit. So that's what I would say. If you have that framework in mind and you start putting down the pieces of your CV, that would help you and it'll be geared. Thank you.
Thank you so much, Dr. Nauman Ashraf. This was extremely helpful. We will move on to Dr. Asif Khan and get some thoughts from him as well.
Thank you, Manal. Thank you, Dr. Ashraf. I think that was a very comprehensive overview, and I do, endorse to be as open and genuine in your application material. This opening remarks, I'll just focus strictly on the new changes in the application, just kind of a quick overview in case if people have some questions that pop up. Last year, we did have a presentation about the supplemental application and the link was provided. The bigger change for this year is that all those supplemental application material, which was actually a pilot study for the last 2 years, Psychiatry participated only for 1 year last year. That those sections have been integrated in your new application now. So you will only have to submit one application. Folks who have been repeating for this year, if they recall, they had to do a separate supplemental application. For this year, everything will be included in that one application that you will be sending. So just wanted to clear the confusion that yes, the supplemental application material has been integrated entirely into the ERAS application, and you will be submitting one. There are a few changes they did from as compared to the last year's of ERAS cycles. The one bigger change that is coming after the integration is the limitation on the number of experiences. So in the past, applicants could write and portray or maybe tell about multiple kind of experiences. From this year onwards, you will be able to only select 10 experiences. So your overall application will have only space for 10, kind of experiences. And among those 10, experiences, you will be able to mark 3 as meaningful experiences. And then with the meaningful experiences, you will be able to write an essay of 300 words on that particular meaningful experiences. Now, the rest of the 7 experiences among the whole 10, you can write about 1,000 words, in my opinion, and you can explain the title, the kind of activity, and all these things. But you'll be able to select among those 10, only 3 marked as the meaningful experiences. And if you look at the new kind of ERAS software, it's a little more user-friendly. So once you enter your kind of experiences, you will have a checkbox. I want to mark this experience as a meaningful experience. So these are some of the changes I wanted to briefly indicate so that the title of this presentation does not be confusing for people. Everything is one application, just to make sure. I would like to share very briefly some statistics from last year. 255 psychiatry programs kind of participated in the supplemental application last year, and only 37% responded to the surveys that we reviewed. That means 95 programs only out of the 255 participated. So whatever data or percentage I'll be sharing in the question and answer, just make sure that it is based on the 37 psychiatry programs that have responded. And just kind of like to take it out and maybe kind of, address any potential questions. The past experience section last year was completed by 90% of the applicants, and most of them wrote 4 to 5. But this year, as I mentioned, you'll have only 10 experiences, and among those 10, 3 will be the meaningful experiences. 99% of applicants who submitted or entered those past experiences, they wrote an essay about it. There were 56% of students or applicants that completed the impactful section, impactful experience. And we have been advised that we as PDs, as programs, do not expect every candidate to do the impactful experiences. So it's an optional again. And then the geographical division preferences was selected by 92% of the applicants. And among those, 96% wrote an essay about it. And then finally, there was rural versus, urban setting a section, and those were filled by 46 to 81. There was a wide variation among that. The reason I shared these brief statistics is to highlight the importance that you're competing with a pool that is filling and using these, sections, I would say, or using these important component of the application. So don't my advice will be to consider it seriously, because you want to be in the application pool. Finally, I think for psychiatry, 90% of the applicants send the signals to the programs. So I will stop here with these basic key facts and then leave it open to question and answers, and share some of the PD side of the statistics if it's pertaining to any questions based on the public data available.
Thank you so much, Dr. Asif Khan. That was super helpful. It kind of helped us look at the statistics and how different people have used different sections of the ERAS application. Moving on, we can have some opening remarks from Dr. Sadiq Naveed as well.
Yeah, thank you. And both Dr. Asif Khan and Dr. Nauman Ashraf has given really nice summary. There's one thing to add. I have heard program directors from both sides, who some like bullet points, some like paragraph. I personally like bullet points, but because my attention span is smaller, so it really helps me to go through the experience pretty quickly. But I have heard opinion from other sides too, like where people like paragraphs. So I don't think it's gonna make or break things for you. So do as you see things fit for you. I will talk about a few things. I think one thing that we really need to be careful about is not having any grammatical mistakes, any spelling mistakes on your ERAS CV, and also in any sort of documents that you submit, including personal statements. So make sure that you run it by Grammarly. I also feel, since we are in a space about psychiatry, there are some certain things, if they appear on your application and if you have US clinical experience, that's going to help. For example, when we talk about patients, we talk about case formulation or biopsychosocial formulation. We do treatment teams. We have individual therapy, group therapy. So see, while you're doing those clinical experiences, if you can have an exposure to them, so you can write those things in your resume. But I also certainly agree with Dr. Ashraf. Don't make things up to fill your ERAS CV. That's going to hurt you more than anything. Just to give a smaller example, for example, if you write down a hobby of stamp collection and you have never done anything like that, and you come across someone who is interviewing and who has similar interests, and they'll have something to connect you with, and they want to talk about that, and you don't have anything to go back to. So that shows that you are not genuine in your conversations or your life. So don't do things to make up things. It's okay to be genuine and not have anything than to make up things and then getting caught later. Few changes, some of the changes Dr. Asif Khan has talked about. So last year, ERAS supplemental application was submitted, I think, on September 15th, and ERAS CV came on September 27th. This year, both of them will be submitted. The deadline is September 27th. That's when programs will have access to your applications, or they can start downloading after that time. So just make sure that if you have things around the way, just submit your ERAS application and around the supplemental application. For the geographics, I will touch on certain areas. I think for experiences, they have limited to 10 experiences. Let's say if you have done internal medicine residency and you don't want to mention it just to think that it may impact your chances of getting into residency, but at the same time, it's going to create a significant gap in your ERAS CV. So I will, be a little bit more strategic about that. I agree with Dr. Ashraf. Compared to 5 or 10 years ago, programs are moving more towards specialty-based experiences. So try to build your experience in around one specialty and try to mention that. Don't make sure, just make sure that there are not significant gaps on your ERAS CV, and just, you know, use active voice. So that's about the experiences part. Anything paid or unpaid clinical experiences that can go into that goes into experience section. Now about the publication part, if you have submitted a paper, you can still write it in the ERAS CV in the section where it says other than published. You can list your conference papers and things like that. For geographical preference, if you want to use geographical preference, it's going to be very popular against in American medical graduates. If you want to use geographical preference, data exists on, you know, people who prefer the geographical area. The data from this year speaks, or last year speaks, about 85 to 90% of program directors used it as a tools to screen out application, but it does not speak about what if someone has no geographical preference, what do they do then? So if you don't have geographical preference, my advice would not be to pick any. But if you do have one, and you know, you are a good candidate in terms of scores and experiences, pick for one. Geographical preference and setting preference is the rural versus urban. Most programs going to be urban or suburban setting. Then, you know, about the signaling, psychiatry is going to have 5 signals. And I will suggest that look at your credentials, talk to a mentor, and see if your the program that you want to signal, if your resume matches up with that program, or that program program application criteria. Only apply to the program where you meet the criteria, but signal where you feel like you hold a chance. So what I have been telling people, that if you get 5 signals, you know, just make sure that 4 are at least at the programs where you have chances of matching, and 1 can be a little bit that's where you wish to match. So, but don't use all of your signals in programs like, you know, that are Ivy League and your credentials really don't match up with that. So that's sort of my summary. I'm happy to answer any questions.
Perfect. Thank you so much. That was super helpful. I would want to invite Dr. Ramis Akhtar or Dr. Fauzia Arain if they have any comments to add before we launch into the question and answer section. What do you say, Dr. Akhtar? Do you have any comments to add?
Thank you very much, Manal. I believe that we can start with question answers, because like, they have very comprehensively, generally covered all the areas, and it would be repetition.
Absolutely, absolutely. Okay, and same for you, Dr. Akhtar? Okay.
Same on my end as well.
Same on your end. Okay, perfect. Just wanted to give you guys an opportunity. Okay, moving into the question and answer sections, I do see that we have a lot of questions in the chat, and we also received some questions through the survey that we sent out. I will start with the survey, and then we'll move into the chat question and answers. One quick question, and this is for everyone over here, is do we want to stop recording at this point, or when we are taking generic questions before we launch into like a back and forth with the audience, we can still continue to record? If everyone feels comfortable with continuing to record, we will continue to record. However, if we think that the conversation is going to be more robust and more honest, if we stopped recording, that's fine.
So Manal, I think the questions that are probably individualized, we can save it for the end, and that at that time we can stop recording. But if there's a question which is more generic, we can take them on while we're recording.
Perfect. Okay. So let's start with the survey-based questions. The first question that we received was how to know which experience needs to go in the personal statement and which experience will go in the impactful experience section. And I will invite anyone who can who can respond to this question.
Okay,
Which
I'll start with this. So I'll give you my example, and so suppose if they had the same thing for me back in the days when we didn't have the impactful experience. So I definitely talked about it at length in my personal statement. But there was a time in Pakistan, there was earthquake in Kashmir, and I went there and with a team of people, and we were there to help the folks out. So that was the most important impactful experience because I learned the interpersonal communication skills there, the conflict resolution, being with those people for 10, 15 days, a group of people, and then you're helping patients, and the patients are like coming in with like people have amputated legs and hands, and the kind of experience you get about medicine and empathy that you develop. So I talked about that in the personal statement at length, but I would definitely use that one of my impactful experiences if I had the choice. So sometimes we think about there's a duplication, but if you're bringing a different angle, I think that experience can be shared. But definitely I'll put it in the impactful experience that actually shaped what I wanted to do, and had a lot to do with the, as I said, the leadership skills also, the interpersonal skills also, but also at a level of much appreciation for the field of medicine. So I would put that as an impactful, that impacted my journey towards medicine, what I would do. So that was most impactful for me. In personal statement, you can talk about other things. Personal statement, the one thing that I like, which one of my friends, like Umar Tariq, he always talks about it, and it makes it very simple. He's like, start out with a bang, end it with a promise, and in the middle, you want to answer why medicine, why this is specialty, why this program, where do you see yourself in the next 5, 10 years? This is a very simple template. And then you can talk about other experiences and hobbies and things that are relevant. So that's how I would probably put it, as that experience as most impactful. And if I don't have a space to describe it there, I may even take it into personal statement if I feel it's very important and there are aspects of the experience that I was not able to share in the impactful side. So it's not necessarily you can't repeat. Like, repeat means you're not going to copy one to the other, but there are aspects of the experience that you can still talk about. So let's hear from others.
So I think you can certainly talk about impactful experiences in psychiatry, but personal statement is also about your personal attributes, your history, your motivations, and your interests, and how that makes you a better candidate for that residency program. So if you have an impactful experience, and if you can link into, okay, how does it prepare you to be a better candidate? I think you can certainly bring it up in your personal statement, and it's okay to do. So I would encourage everyone to go through. There are certain ERAS guide when it comes to explaining what can come under impactful experiences. So that's not every experience is impactful experiences. Something that happened in your life that is adversity, that's for example, they give some examples like loss of a family member, serving as a caregiver, limited educational opportunities, first generation to the college as a graduate. So some of those experiences, that's something that you can do as an impactful experience. But again, remember, you don't necessarily have to fill that section if you feel like you don't have an impactful experience.
Absolutely, thank you. Dr. Asif Khan, would you want to add something?
Yes, I think most of the things have already been covered. The impactful experiences, as I mentioned, 56% of the people only responded, and we all know in the programs have been instructed not to expect this section from each and every candidate. And when it comes to it, Dr. Naveed alluded to it, they have shared some examples of what an impactful experience could be. I'm bringing up this, chart. Just give me a second to give you a breakdown of what people did last year. How did they broke down their experiences? That should, kind of address people and, not to follow this pattern, but, just to have a general idea. So just give me a second and I'll be able to highlight that here.
Okay. Should we in the meantime move on to the question, another question?
Yes.
Okay. So somebody asked, what are the most high-yield volunteer meaningful experiences other than electives, observerships, externships, or research or house job? So they're basically asking, I think, if you have 10 experiences that we can put in addition to observerships, externships, research, all of that, what can they put in there to have their whole 10 experiences? Or do they need full 10 experiences? Do they need to put all 10 experiences, or can they get away with only the ones that they have done?
Yeah, I think they don't need to put all 10. Of course, if you don't have the experience, then don't stretch it out. Put down the important one and the meaningful experiences that you've had. There's so many things you can think about that are meaningful. Again, the category that they have talked about may cover a lot of them. So like I always talk about it, if you don't get any observership, we think about clinical attachment, some sort of clinical setup. But even if you don't get that kind of attachment, just work in a crisis center and see how people come up there and how the crisis calls are screened. How do you talk to a distressed person? That is a very important, meaningful experience, because what you gain, you can talk about that in your CV. Volunteering at a soup kitchen, if you did that and that was something part of you, you did it once a month, or you volunteered at a community clinic, that can be a meaningful. There's so many things you can put down, and then other skills that people find meaningful. I have seen people would talk about their extracurricular skills sometimes as well, like participating at a state level for some sports events or debate competitions. In our field, conferences are important. So like say ACAP, APA conferences, if you participate there and you got any travel award or you worked as a monitor, those can be important experiences to share too. So there's so many ways you can find things, but do not try to stretch it to 10. If you don't have enough, 5 or 6, fine. Just find one impactful, 3 meaningful, and just leave it at 5, 6 experiences. That should be okay, I think.
I would just, I completely agree with what is said. Also, I think if you have a training experience where you can talk about your qualities as a resident, I think that would be something significant. Even it is smaller in length when it comes to time, I will mention that. But anything that can highlight your attributes that can be helpful being a medical student, medical resident, I think that's something you should be able to talk about. But again, don't try to make up to 10. We know that people are graduating within a year or 2 years, or actually they're applying within a year or 2 years. So they're not going to have all 10. So as much as you can, that would be helpful. And, talk about different attributes like empathy, conflict resolution, team leadership, multidisciplinary team, anything specialty specific experiences. I will mention that. There's a question that I'm seeing whether it has to be clinical. It doesn't have to be clinical. It can be clinical and non-clinical, or research that can go in there.
Thank you. I think I would just jump in, Manal. If you don't mind. I think I would just carry on this conversation first before I go back to the previous question again. I think the meaningful experience, the concept behind that is, that any experience that you feel that has influenced you and shaped you, and that can be tagged as a meaningful experiences. As I mentioned, as compared to last year's 4 to 5, which was an average based on the data analysis, this year's only 3. Now, just to reiterate, most of the components of the supplemental application are reintegrated into this one application. So if you guys look at our presentation from last year, you will find out that in this cycle, for this 2024 application cycle, you'll have an ability for each and every experience, you'll have an ability to select key characteristic, the experience type, and then the focus area, right? So once you're filling those 10 experiences in your mind, the first step will be to fill the 10 experiences first, right? And then see which one is based on the focus area, the characteristic is most impactful, that you can consider it as a meaningful experience, and then write a 300 character essay about it. I would encourage to write about it because I shared with you guys the stats that most of the people are writing about it. Even for the geographical preferences, if you don't have any preference, 80% of the applicants indicated why they don't have a preference. So explain yourself if you're given an opportunity. So that's pertaining to this question. For the previous question of the impactful experiences, I would just go on some of the breakdown. Based on the last year's data, persistence, resilience, and response to various obstacles, challenges was filled by 25% of the applicants. Personal, illness or death of the family member was felt by 23% of the applicants. And then getting accepted to medical school, residency, the whole journey about that was 20%. Financial hardships was 14, and then academic struggles, including testing, was 12. The rest of the experience, impactful experience, I say themes were 10 or less than 10%, and they include first generation pursuing a higher education, assimilating into a new culture or country, family related difficulty, and the theme list goes on again. All of this is public information. Read these, you'll have an idea of how people did last year, but what you wanna focus on, what is most important for you, and what do you think has really influenced and shaped you, and that's kind of my nutshell for these two questions.
Perfect. Thank you so much. Just to summarize so that I also understand, is that they can put in experiences which are both clinical and non-clinical. And within the non-clinical section, they can have administrative experiences if they have served on a committee, if they have been a part of some psychiatric organization. They can also talk about their teaching experiences if they have had, if they have given tutoring classes, or because sometimes residents are required to teach medical students and stuff like that. So if they have teaching experiences, if they have helped people be mentored or prepare for USMLE and stuff like that, that can also go in there. And then leadership experiences, because sometimes programs will also gauge an application based on those experiences. And one example that I saw that I'm just because the season is on for fellowships as well. One thing that I will give an example for is that if someone's talking about their teaching experience, if they say that they have been a tutor or a mentor, and they will describe that experience in terms of what it was logistically and concretely, but then in the impactful section, they will put something along the lines that as a first generation college student, it's really important for me to pass on and to pay it forward. And that is why I am interested. So they connect it with their story and tell us why it's impactful, personally impactful for them. So I think that kind of gives you an example, if that's helpful, on how to tie experiences with impact.
Right. And I would just add just one thing to what Manal, you were saying. So talk about your experience, but the problem that we have seen in the series of IMGs is the ability to reflect and sort of talk about their stories. And that is what people like here. So you need to learn that skill, and you can sit down with someone who knows about it and try to explain it. Don't just list that I was member of say AP or ACAP and in this role. No, what you did in the role and what you learned from it, the attributes you have to convey. So pay attention to that you have to create a story about these things. That's all.
Absolutely. Absolutely. And moving on to question number 3 that we had, how much impact does geographical location and signals will have in the match?
So I think I'll take it first. I think it's a pretty broad question. Nobody can predict what this year outcome will be based on the last year data. A lot of the programs, majority of them consider it as a screening, as a holistic part of a complete whole picture of the applications. Again, for programs, right? Signaling in itself is a screening tool. It's not a qualification. If you signal a program and you're not fulfilling their admission criteria, then that signal is not going to be taken for qualification. So just want to make sure that you signal thoughtfully and look at your kind of application and look at what the actual chances are that your application will be reviewed. Most of the programs, however, and I can share the percentages, but majority of them did find out that signaling, have or maybe were used as an initial screening before a more thorough, application review. Some of the programs based on the geographical divisions and signaling mentioned that the signals or the geo preferences highlighted the application that they could have otherwise not, kind of reviewed that thoroughly. So that should be like a rough and overall picture of, yes, it can be supplemental to whatever your whole application is, in my opinion.
I'll piggyback on that question and ask another question. So for example, if someone is applying if they give an area that they are interested in Pacific region, but they're also applying to a program in New York. So how would the New York program view their geographical location? Because they have put in the geographical location that they want Pacific, suburban or urban setting, and they're applying to a rural program in near New York or something. How would that be viewed by a program in the New York?
I can take a question. I think, most of the time when geographical preference come, American medical graduates use them more often, and they do have geographical preferences. That's why I keep saying to people that if you don't have geographical preference, you don't need to mention geographical preference. Just write an essay and see why you don't have a geographical preference, or what's the reason for that answer. I mean, IMGs fly from like 5,000 miles. I left my home country. I can go in California, I can go in New York or in Midwest and get trained. When it comes to AMGs, most of them, they're going to choose for some geographical preference, and they're not going to be applying for like 100 programs. They're going to be applying for 30, 40 programs. And there are enough programs. So for example, if you use 3 subdivisions in Northeast, you're going to find that much program. And then if there's a program, let's say in Pacific, in California, then you should be able to talk about what is it that you liked about that program, that, you've picked 15, 20 in New York and New Jersey and New England area, or Northeast. And what was it that about UCLA you liked, and why do you want to be there? So going back to, and also adding up to what Dr. Asif Khan said, all of these are screening. These are aids to screen a candidate. It's not a filter. It's not gonna. The recommendations are use it as an aid, not as a filter to screen out your application. So as an IMG, if you don't have any geographical preference, please don't indicate that you have a geographical preference. Just mention the reason in the paragraph section, that why don't you have any.
Thank you, Dr. Naveed. I think you actually kind of alluded to most of the things. I would just want to add, do not confuse saying no preference versus not clicking that option. You have to say no preference and then explain it. If you just skip it entirely, then it will appear to the programs. Coming back to Manal, your question, no information will be displayed to the program if you just skip that question. But if you say no preference and then explain, then the programs will actually take it as like this candidate is open, and that is what the survey also showed, that the programs interpreted as like this person is open to kind of get, or maybe their values were more kind of aligned to what type of training they wanted. So they actually like interpreted as a more kind of an open applicant per se. And then to your original question, you can actually have about 3 division preferences in your application. And then if you choose a program outside of the division preferences, that program is not going to be seeing any information. So for that program, that section will be blank and nothing will be visible. Now, if you apply to the geographical location preferences, preferred programs, then they will see that this candidate is interested in the region A, B, and C. I hope that answers that original question.
Yeah, so from like our end, why this becomes important, and so I want to share the administrative side of things. So, with for all programs, they want to train people and then they want to retain people when they graduate. So they're looking at the people. Okay, we got 3 good people and they meet our criteria. Which one should we send out the interview? And who is going to stay in this area after 4 years, because they're working on the recruitment at the same time. So that's where I've seen some programs preferring people who are from the closer zip codes or the closer area, so that the older system was look at their permanent or the temporary address where they're at, and you would probably prefer them and send them out the interview. Now it's signaling. So if you have the preference, you have a spouse, you have someone, use it to your advantage. If you don't have it, as it's been said already by Dr. Khan and Dr. Naveed, just leave it blank as an IMG.
Perfect. Thank you so much. Moving on to the next question. And now we're coming to the questions in chat. Should the 10 experiences be written in the order of timeline? Because we will select 10 important experiences, which might not necessarily be consecutive.
I don't think so. The most important has to go first. Again, short attention span for everyone, and they don't have much time. They want to read the most. So the most important one should be highlighted first, so they can read it. And before they get to your 10th experience, maybe they already have a good idea of you with the first, second, and third experiences. So I don't think so. If there's any requirement for chronological, I would personally prefer the most important one, the most meaningful to you, should be at the top.
If I could pose a follow-up question to you guys about this, for applicants, is there a time limit that you consider in terms of these experiences? Like if someone's applying if someone has a long gap from when they're applying, should people write about stuff they did in high school or like middle school, or are you looking for a certain period of time after which they should mention stuff?
Again, you are highlighting your attributes, right? So somebody in high school was the president of certain chapter or certain club, right? And they did volunteer work and they gained certain skills, and they're going to talk about it at somewhere. That may not be the first experience I'll talk about, because there has to be some sort of, like, if you're talking about in that sense in the chronology, yes, there has to be some, but that experience needs to go there because it's highlighting the attribute. I'm sure there are going to be more recent ones where they have gained some of the experiences, but if it's significant and even it happened years ago, I would still tie it up with something that I have continued doing recently, but was impactful. It was impactful.
Yes, I would say also that, with the experience types, you'll have these added buttons now, drop downs of what key characteristic it is, or it was, what was the focus area and what was the, experience type. So I don't recall there is any limitation of how far you can go. The limitation is on the number of experiences, because I think overall the research and the data analysis from previous years showed that it can go on to redundancy at times, but those were the numbers picked based on some of the research that they did in the last 2 years.
Absolutely. Okay. Then somebody asked, is it worth applying to psychiatry residency if you're an old graduate with good scores, but only have 1 LOR of psychiatry externship? This person was unable to get other US clinical experiences due to visa rejections. CV is full of general practice for earning, but your passion is psychiatry. So basically the gist of the question is, I have 1 LOR from psychiatry externship. That's the only psychiatry externship experience that I have. And my CV kind of speaks to general practice.
So I can start with this. I think the most important thing is that what Dr. Nauman Ashraf mentioned early on, the specialty-based experience, specialty-specific experience. Having visa or no visa does not limit you to continue to gain psychiatry experience in the country or the place where you are. I think, if your most recent experiences in psychiatry, let's say in the last 6 months or 4 months, you have done some psychiatry experiences, that would be helpful. again, people shift their careers all the time, their specialties all the time. So let's say if you worked in primary care for, let's say, 3 years, but in last 6 months or 1 year, you have been doing more work in psychiatry, even if you're in Pakistan, and doing the work there, or in Dr. Das' case, he is in the UK, I believe. If you're getting that experience, I think that speaks to something, and that is valuable experience. But if you have only one externship out of last 4 or 5 years, and that externship was 5-6 months ago, and you're still continue to do experience, let's say in Pakistan in internal medicine, first thing that I'm going to think of it is if psychiatry is a backup option for you.
And I think at this point, we should stop recording as well, because we are getting into the territory of a little bit more individualized and personalized questions. So I will stop.